Hello, my name is Bobby Jo Braun, and I am doing a GM 200 Introduction to Speech class with the American Military University. Today I am going to inform my classmates that post-traumatic stress disorder, which is known as PTSD, is not from only being under fire in the line of duty. I want my classmates to support and lead and learn the effects of sexual abuse in a child for many years, and that can cause post-traumatic stress disorder after a deployment. PTSD is known as a serious medical disorder in soldiers coming from deployment. Soldiers that are under fire, they witness death of a battle buddy, and also the soldiers that have had a past trauma in their life prior to deployment also can create panic disorders and PTSD symptoms. And even the fear from being over in theater can aggravate these past traumas in soldiers, and harassment and sexual harassment while being deployed, and even death. PTSD can be caused by trauma from life experiences as well as combat. In an individual, they can witness a life-threatening situation in civilian and combat. Natural disasters, it can be sexual abuse for many years that have been suppressed, even rape that is suppressed, accidents and terrorist incidents also. PTSD usually comes in physical symptoms and emotional symptoms. And some of the physical symptoms are headaches and rapid heart rate with chest pain, and also dizziness may occur, and usually does. In the emotional symptoms, you have intrusive memory, intrusive behavior. You also have problems concentrating and remembering even the simplest things, like how to come home from church or how to get to the store that you've been going to for the last 4 years. Anxiety also, and panic disorders are emotional. PTSD can cause individual and family problems. You can become isolated, go on to drinking binges and drug abuse to hide the feelings and the confusion. And also it can have self-harm and self to others if you're isolated. Family problems, stress leads to yelling and not having the ability to have a calm two-way communication between you and your spouse or your commander or family member, your children especially. They don't understand. Not being able to work because of the ability to concentrate or remember what's next, and if you've been doing it for so long, is another symptom of PTSD. And your marriage suffers, and if you don't get counseling and you really don't have a grip on learning how to take control of your PTSD symptoms, your marriage can end. And PTSD, it takes courage for somebody to stand up and say, I need help. I stood up and said I need help, and that took a lot of courage for me. I was sexually abused all my life and suppressed that and thought it was over with through counseling as I was older, and went to deployment and came back out through innuendos, sexual emails, sexual harassment, all those things, and always being careful and on my tiptoes and being fearful all the time created a PTSD signs and symptoms inside of me, and that's not a good feeling. There's a couple of places you can go for help. There's the VA medical hospital, and there's also MTF medical treatment facilities. The VA hospital usually will start you out with seeing a psychiatrist. And a psychiatrist is a person who will look over your PHAs, which is a post-health assessment. And you'll usually have one of those 30 days before you come home from theater. And then your 30-day, 60-day, 90-day reintegrations, you will also have that as well, so we can keep an eye on our soldiers to see if there's any signs or symptoms that may be occurring at that time. From there, the psychiatrist will take a look at the medications that may help your symptoms, and from there you will see her for once every 2 weeks, and then once a month, and from there once every 2 months, just to see if your medications, if they need an increase or a decrease, or if you need a change in your medication. And the psychiatrist has a second-hand man, which is called a psychologist. And a psychologist is somebody who works with a psychiatrist behind the scenes. The psychologist will listen to you and help you understand or help you explain or feel what is going on with you. They are trained to do that. They'll help diagnose your situation and with the psychiatrist. Then she will lead you into a plan of therapy, like a DBT program, which is a dialectical behavior therapy. And that'll give you your tools to either overcome or deal with your PTSD, panic disorder while you do have it. We are aware now that PTSD causes and is aggravated by deployment. Soldiers, we need to pay attention to other soldiers that are experiencing the physical and emotional symptoms. If you see that happening, ask questions. If we are not healthy, we cannot help our family to be safe, nor can we help ourselves to become safe or others. It takes courage to step up and admit that what is going on inside. And a strong soldier, a soldier that is screaming and crying inside to ask for help for a VA hospital or a medical treatment facility. Sometimes it's embarrassing, but do what's going to do to help you get through. And this is going to help you protect your family, yourself, and everybody around you, and even your future. Now, even if you think you're getting better, never do anything without your doctor's consent, like getting off of your medication. You may think you're feeling better, but you let the psychiatrist make those moves, and if you're interested, then you need to speak to her about that. Always, there are many soldiers that have deployed are coming home to return to a home of anxiety. According to the Service Member and Family Handbook magazine, PTSD and after combat related handbook, stress reactions, there are 3 of them, 3 stages. One is the acute stage, and that is usually from 0 to 3 months. You have signs and symptoms of post-traumatic stress syndrome. And then the second stage is the chronic stage, and that usually stays 3 months to years. And the last stage is a delayed stage, and that happens when the signs and symptoms don't occur until months or even years after the trauma has happened in your life. Now, although your marriage was strong and wonderful before deployment changes people, and I know that by experience. Even the spouses get changed. The spouse and the soldier need to learn how to communicate, and again, they need to give each other space. And to learn to communicate, counseling is the best way if you have not done that already. address the challenge, the stress, and get support needed so you can get back together with stronger bonds. Although you think you know all about PTSD and you can manage it, you do not have to be alone. Psychotherapy and medications along with self-help, like techniques that may involve anger management and dialectical behavior therapy, DBT, will give you tools to use, and you can use those tools for the rest of your life or until the PTSD is active in your life. Thank you.